Good evening, Frank. Good evening, everyone.
Good evening.
Good evening. I'm talking away and not realizing that I was muted. Good evening, everyone. Good evening, Mia.
Hello.
Hi. Okay, so we have Deborah. Okay, so Deborah's just visiting with us, right? Because I don't think she's Hello, it's Alfred. You're muted.
It's Pesach Albert,
Yes, up, Albert. But you are
I believe.
muted though, so I can't hear you. You're muted.
Okay, sorry about that. Good evening, everyone. How are you?
Good evening.
Hi, Pesach Alpert. Nice to meet you.
Same here. I'm Miss Leopold. And you can call me Fran.
Fran, great, pleasure.
Same here. Okay, so Mia, can you not record yet, please? Let's wait until 5 minutes. Give the people 5 minutes more to come in. Thank you. 7:05. Good evening, everyone. I know the summer is just ending, but we're still in summer. It's as hot as summer. So, but I trust in that each one of you had a chance to do something special for the summer. For those of you who don't know me, and I think that the majority of you online now that I am saying the names, I don't know you, so I'm assuming that you don't know me either. My name is Francisca Leopold. I'm the second vice chair at Committee Wood 9, and also have the privilege of serving for quite a while as the chair for the Health and Social Services. Tonight, our meeting is more or less getting to know each other, and then together collectively, we're going to plan as to the needs when it comes to health and social services for the community, as to what we can plan for the next 3 months down the road, and going further down, we can plan our agenda as to what we want to do. As anything else, I know persons are coming from work, but I love to see persons' faces. I love to interact, and saying that we are just getting to know each other for the first time. Those of you who can turn on your camera so I can see you, you can see me, but I can see you. So I'll be happy to be able to see your face, and I'm just seeing a name with a box. I don't like to speak to the dark box of just a name, because I know I would like to see faces, put a face to the names that I'm seeing. So if you don't mind, I would appreciate if you could just turn on your cameras so that I could see who you are and we can have dialogue together. It pumps me up and makes me feel better that I'm talking to somebody. I'm saying who I'm communicating with. So without further ado, I would really like us to introduce ourselves, where we are in the community. As I have already introduced myself, I'm Francisco. I live down the block. I don't know how many of you live in the community or close by, when I mean not in the community, but close by me. I live on Lefferts Avenue, between Bedford and Rogers. So I'm very close by in the community. So I'm going to turn over.
Block.
Yes, it is. Thank you. And I'm also the president for the block. So I have 2 blocks, range from Rogers Avenue to Washington. So I have those 2 blocks that I'm the president.
Are you in the running for the greenest block this year?
So we were, but we didn't make it. We just got honorary mention because we have a lot of new persons on the block, and then the window sill and the different things that we want to do. Persons, we have new persons who came in, so they didn't participate. And we had a culprit who came on the block every night, and he would pull all the plants from the pots and then just dump them on persons' cars. Yeah. So every night, so we have a Yeah, we have a snapshot of him. We have him on video. He did it on Lincoln and he came to our block, so he was just pulling out plants and, and just destroying the plants on the block. But
I
we're
didn't
going to
realize how
mention.
heated the competition gets.
So we're going for it. We're going for it next year.
Okay, keep it up.
Yeah, thank you. And thank you guys. I do appreciate, with working together, collaborating together and turning on your camera. It's really meaningful. So I'm gonna ask, I'm looking at my screen. So I'm gonna ask, start with Mia, our assistant district manager, and then she'll just pass it on to the next person who will introduce themselves.
Sure thing. Good evening, everyone. My name is Mia Hilton. I'm the Assistant District Manager at Brooklyn Community Board 9. I've been with the board since 2017. I am a resident of the community. Happy to be here, hopeful for the meeting session so that we can accomplish some meaningful activities and connections with the community.
Pass it on, Mia, to somebody else.
Enid. It's been a while since I've seen you. Hi, Enid.
Hiya, how are you, Mia? Good evening, everyone. My name is Enid Dillard. I'm the Senior Director of Marketing Communications for One Brooklyn Health, which encompasses Kingsbrook Jewish Medical Center, Interfaith, and Brookdale Hospitals. It's my pleasure to be on this committee for quite some years now, working for the betterment of the community and to see however we can help. So it's my pleasure to be here this evening.
Pass it on, Enid.
I pass it on to Menachem. Did I say it right?
Yeah, spot on. Thank you.
Hey.
Hi, everyone. My name is Menachem Schoenbach. I've been a resident in the community for 20 plus years. Grew up on East New York. Now I live on Rutland Road. I'm a mental health counselor. I've interacted with, many different parts of the community, many different people. It's a place I love, and I'm looking forward to participate in improving it.
We'll pass it on to somebody else.
Miss Carmichael. I only see an N.
Oh, first name Nyasha,
Hey.
but Naya is fine.
Hi, Naya.
So I'm Nyasha. I'm an immigrant to the community. I've been here for about 10 years, and I'm just trying to get involved and associated with my community.
Okay,
And
pass it
I
on.
would pass it on to Ms. Sab.
Thank you. Hi, good afternoon, good evening, everyone. My name is Doyen Saab. I'm a research scientist with the New York City Department of Health, and I work in a lot of HIV prevention work, HIV care and treatment, and sexual health and racial equity stuff. And so I'm really excited to join the board. I'm a new member. I joined in late spring. I'm just really excited to be involved. I've been in public health and community health forever, and I would love to be a part of efforts to improve the health of the community. I am on Nostrand and Winthrop.
Thank you. Pass it on.
And I'll pass it on to Alexandra.
Good evening, everyone. My name is Alexandra Cameron. I am a resident of the community for about 20-something years now. I am on St. John's between Underhill and Washington. Thank you.
Yes, pass it on, please.
And let me see. Who can I pass it on to?
Rashad hasn't gone yet.
Who hasn't gone yet?
Rashad and Deborah. So
I'll pass it on to Deborah.
Deborah, are you there? Okay, I think there are some persons who have connectivity problems. So Rashad, you pick it up. You're muted.
Hi, good evening. Sorry about that. So my name is Pesach Alpert. I've been in the community about 15 years. I currently live on Rutland and Brooklyn. I I'm a healthcare advisor, work very closely with the elder community in our community and the extended community, making sure everyone's covered properly. Also a cardiovascular sonographer. I've worked at the couple local hospitals in Brookdale and SUNY Downstate to working together to make it thrive.
All right. Deborah, can you hear us? She's not, I think her mic is off. Okay. So, and Barry have been trying to connect for a while now. So I am so happy. I'm just saying, I'm just hearing your backgrounds and what you're bringing to the committee. I am just so ecstatic. I'll give you a little bit more. As you know, I introduced myself as the second vice chair on the board and the chair for Health and Social Services. So I also serve as the chair for the review board at Kings County Hospital. And I work for the city. So I work for the city as an associate human rights specialist. And what I do, and I'm happy to hear that the majority of you are giving back to the communities, because that's just my aim. That is just what I love to do. And my 9 to 5 is that I go out and I do presentations, I do trainings when it comes to discrimination in housing, discrimination in employment, discrimination in public accommodations. So I let persons know what their rights are under the New York City law, regardless of the immigration status. So if in your moving around, in your interaction with persons, and you find anyone who have issues when it comes to housing, they have been discriminated on the street because of their religion. And we covers under our New York City law, which is part of the mayor's office, we cover over 26 to 27 different categories of discrimination. So this is my 9 to 5, and on the side, as I said, I'm the chair for Kings County. So I work very closely with behavioral health and patient care and all the other, and a lot of the other, I have a few more committees, under my slate that I work with. On the 25th of August, hello, Miss Love. It is so good to, you are here, and I will allow you to introduce yourself soon. On the 25th of August, I hosted a seniors party at Kings County, and it was lovely. And the theme was living life like it's golden. So we had the seniors coming in, and they had the massages done, and they had the pedicures, and then we showed them a movie. We had prizes, they had bingo, and Miss Love, she provided lunch. We had such a good time, and the seniors, they're looking forward to it. So I'm going to make it an annual thing so that we can have it. But outside of the hospital, under the umbrella, because the community board and the hospitals, they are working hands in hands. We are not working separately, or we're working as a unit. So as we do things on the outside, the hospitals will be working, One Brooklyn Health will be working with us, and Kings County will be working with us as well. And I'm looking for us to do much work this year when it comes to mental health, when it comes to obesity, with diabetes, HIV, all the different stuff that's plaguing the community health-wise. But then there are other things that we could bring to the community as well. We could bring some fun. So the place here is just not for me, and I'm coming, sit here, and I'm saying do and do and do, but we will be working together. We'll be collaborating. We'll be putting our minds together. Everyone will bring something to the table, and then let's just make this committee this year be a boiling pot, where we just throw everything in and we just start pulling stuff, and we say, okay, this is what we'll do this month, and this is what, because we have young blood, fresh ideas, young people, and I'm looking forward to you guys to just, as we sit down and we say, okay, we're already in September, and so we can use September to be because what I will do, first of all, I would need someone who really will be able, because we had the secretary, because of health issues, he had to step down and resign from the board. So I will need someone tonight who would volunteer to work with me to take the minutes and everything. So after the minutes, 72 hours after the meeting, then the minutes will be put together and sent to the board office. So they will have it, and then a week before our meeting to 2 weeks before our meeting, at least a week before our meeting, then the agenda will be put together and so sent to the board office so that they can put it out there. So I would like someone tonight who could volunteer tonight to take this up. It's just one. The meetings are being recorded, so you can get the transcript from the office and you can just pull it. We don't want everything that is said, just pull it out, pull out the most important things that are discussed, point of discussion, to be part of the minutes, and so that we could have them for the general meeting so that they could put it out there for persons to see. And then it's just a matter that I just send out the agenda. And then we are looking for ways, because we cannot really do fundraising because we are still seen as the board as a government entity, so we can't go out there doing fundraising and trying to get monies on our own. But then we have the Friends of, so we can do it through them and come up with some ways that we could have some monies, because whatever that we need to do, because there is that space where we can, the city would not give us money to do certain programs we want to do in the community if we want to give back. So we'll be working with them to get sponsors. I'm really looking just to really broaden this time coming, this new year that we're in, so we can get sponsors, so we can get, when we bring the seniors together, that we can have little giveaways to them, give them little something to take away. And then also that we can also work with the youth committee, so we can also do something with them. Because it's very important, I know that when it comes to mental health affects from the baby come up. And then it is something that we should not wait until something happens in the community and then everybody's running and we're gonna do this and we can do that. And after it dies down, everything goes normal. So we just want to keep the momentum going. We want to have workshops and forums when the community could come. Yesterday, while I was coming home, someone stopped me and said, "Hey, friend, Miss Leopold, and what's about the trees and health and social services and the trees and the environment and the this and then the that that's plaguing our health and everything like that." So persons do have ideas, and then as part of the committee, it's in our hand. It's not just in my hand, but it's in our hands to sit down and implement programs that will benefit the community. So, Ms. Love, I would like you to introduce yourself. And I'm not sure if we have anyone, Deborah. I'm not hearing anything from Deborah. Barry is still trying to connect. And then after that, and then we have someone, Antoinette just came in. So after Miss Love introduces herself and she shows her face, Tonietta will introduce herself. And then I would like one person who can just volunteer to be the committee secretary. So as we speak and when we discuss, you can just take the notes. You can, whatever notes you want to take, you can take it, or else you can just reach out to the office and let them send you the transcript to put it together. Go ahead, Miss Love. Jackie? Okay, so if Jackie is not available now, Antonietta is Mickens. Can you introduce yourself and let us see your face, please? Okay, so those two persons, they're here, but okay, you mute yourself again. Go ahead and unmute again. I don't know. Something is happening. You keep on muting and you will be muting yourself. Okay, so whilst we are waiting for them, is there anyone who would volunteer who is part of this group, who would like to do the minutes for us? I don't want to volunteer anyone. I'm just allowing persons to just volunteer yourself. Okay, so I'm going between Miss Becca Michael and Sab. Is Sab here? Is Sab? Okay,
I'm
so
here.
okay, so between the two of you, which one would like to do the secretarial work? You Sab, Miss Michael, you're part of this committee, right?
Yes,
Or you are just a okay. So you're not just a resident, you're part of the committee.
I'm a resident committee member.
You're a resident committee member. And Sab, you're how do you pronounce your first name?
It's pronounced Doyen?
Doyen?
Correct, yes.
Doyen, okay. So as a committee member, would you like to, as part of the committee member, would you like to do us the honors? And
Yeah, that's fine. I can do it.
and I will ask Mr. Michael to be your assistant, because the day that the two of you all could collaborate, so the days that you're not able to do it, you know, because everyone has stuff doing. So if you're not able to do it, then you could call on her, and then she can. Is that okay with you, Mr. Michael?
Yes, that would be perfect. That would be
Okay.
fine.
All right. So the you can. Well, we don't have a chat, but I'm assuming that Mia can send the numbers to your telephone numbers to each other. Just share those numbers with them, because we don't want to put it out here. And then so that but then also as we do that, Darian, we would like to have, I'm assuming that you're technical because you are young, you're tech savvy. So we would like to have a WhatsApp group, WhatsApp, so that we can, you know, communicate anything that's going on. Somebody have any ideas, we can just throw it in there. We can, you know, so be able to keep, because we only meet in here once a month. So but we want the conversation to continue as to what we want to do. Anybody have any ideas or anything, we can meet outside of the general meeting. All right. Miss Love, are you back?
Hi, I'm here. I'm sorry.
Okay. Can you show your face and introduce yourself, please? And then you can go back to your box.
Wait a minute, it's not doing it. Oh no. Okay, hold on. I'm trying to figure it out. There we go.
Okay. There you go.
Good evening, everyone. My name is Dr. Jackie Love. I am the founder and CEO of Grandma's Hands. We provide support services, light case management, and intergenerational programming for seniors and older adults who are still caring for children. And we are also currently addressing food insecurities, you know, working with seniors who are living in food deserts, and combating food equity, or food inequity, rather. Did you need anything else from me?
Oh no, I was just waiting. I thought you were concerned. I know you do a whole lot in the community, but I don't think I had the opportunity yet to really thank you for last month, you know, for your persons who came out, and I got lots of feedback on the food provided, how good the food was. I didn't get to taste the food, but somebody said, oh, that food was so good, and the chicken was so good, and everything was so good. People really love it. So thank you.
Good.
Thank you very much. So,
and we're also a part of the beta program that Downstate has going on for involving diabetes and wellness. We provide the meals for them as well.
Okay, cool. That's wonderful. So as what I'm gonna discuss, because since it's our first meeting, I don't want to keep us here for a whole hour, because we don't have too much on the agenda to discuss. It's just a matter of introduction and getting to each other. And then as we go throughout the month, I will be placing Diane, you have the names. Mia, can you send send her the names of each person, the list that I have, send it to her so that she will have it, as well as the telephone numbers, so she can set up the WhatsApp group. So as we right there and we hear about COVID, so I would like us to work on a mass drive to see where we can get masks to give out in the community, as well as I don't know how we will be able to do that, but somehow we will get masks, so we will be able to go out in the community right there by Community Board 9, so we could meet a day, so we can give out masks, we can give out hand sanitizers, and then we can also work with Miss Love to see what else that we can have for the seniors. If we can give them some vegetables, we give them some fruits, whatever that we can, we could collaborate with. I know Council Member Rita Joseph, she's very much involved and care for the senior community. So I will be reaching out to her and let her know that is what we are aiming to do. So we'll maybe get some support from her, funding, whatever we can get from her, whatever support we can get from her, so we can have something. We are yet to figure out as to which day, because we don't want to do it when it's too cold, especially for the seniors. So we want to do something for the seniors. Mia, the Carroll Gardens is still not available to us. We still can't use that hall.
I'm sorry, Carroll Garden, no, they haven't registered as a vendor, so it's really at their leisure if they decide to donate the space.
Okay, because if we could have get to use Carroll Gardens and we can do something for the seniors, because I know that although I did the seniors party and we did it at the hospital, but because it rained that day, there was a thunderstorm, so many of our seniors didn't turn out. Persons who registered didn't really turn out. So I was looking if we can do something special. Maybe I know Miss Love usually do that, but just do a little something special for the seniors before outside gets too cold. And then we can we'll have masks to give away, we'll have the hand sanitizers to give away. But it is something that I will call. If I do put in the chat, I'll put in the chat when the WhatsApp group is established. I'll put in the chat the login, and I will call in for a meeting that we could come together and say, okay, this is what we'll do, this is what we're going to do, and we'll decide as to which month. Let's give ourselves, so we'll meet sometime this month in the evening time. I rather meet in the evening because I know persons are going to work, some persons have children, they have to come home, people have lives, so I don't want to take much of your time. So usually I will just meet maybe 8 o'clock or 7 o'clock, whichever time, put it in the chat, so whichever time is best for everyone. We'll meet and we'll just discuss as to what we want to do, maybe in the month of October, what we want to do for them. And then also we are looking to do work on forums on maternal health as well. So we'll be working on maternal health. We'll be working on programs for the seniors. We'll be doing for the diabetes. I know sometime a few years ago, Ms. Deliard and we did during COVID, we did an online healthy cooking during COVID, but we can do that in person and have a cooking class, so we could figure out as to what we want to, what the menu should be. And persons, if food could be cooked there, they should have to do. The last time the lady showed how to do a nice spinach salmon, although we were just watching it online and it tasted so good just watching it. And we were with him, just watching the way she was doing it, so we can look to do that. So any other ideas that you have as Ms. Dion, Doyan, put the WhatsApp group together, just write it on paper, because sometimes we think of stuff, the thoughts come and then it leaves us. So just, let's make a note of it and then you could put it there. Just give me a call. I would like each person in the group to have access to me that will be able to call me. So when the WhatsApp group is up, you'll have my telephone number, you have my email address, so that we'll be able to communicate, you know, and if you just want to call me, you just want to drop me a line, and that's fine, because I really want us to do some good work. And I don't really want us to be just behind the screen. I want us to go out there to do stuff, you know, to just do in the community what, as you walk past the community, anything that's pertaining to health and social services, and you think it's something that we should, you know, embark on and we should do something about it, just bring it to the table and let's work on it. And in it, whatever is happening on your side, let us know if we have to come out, if we have to do presentation, and then even on the side of that, because even in housing, we have a lot of persons who've been complaining when it comes to asbestos and the lead paint and different stuff that is affecting their health. You know, so whatever issues that you think, and each person here is coming in with their own background and the specialty. And then if we just bring everything to the table, that one person could say, okay, I'm gonna handle this. And this other person would say, okay, I know how to handle this, I know this. So let's just come together to the table and work as one. Okay, dokie? Any questions, any comments, any concerns? Anyone have any comments? Yeah, talk to me. I know that y'all are really a little envious right now because I'm sitting on the beach with the palm tree behind me, and then you just wish that you all were there. It's okay. Don't hate on me, but you can still talk to me. You know, unmute yourself and talk to me. It's okay. I'll remember to bring you back some coconut water wherever I am. I can't tell you where I am.
So Ms. Fran, when are you planning to do the maternal health piece? So October would be the seniors. What month would you be looking at to do the maternal health?
So maternal health, we can tackle maternal health. You know, we can tackle them anytime because maternal health is something in our community that implicates our community. So it's all left to us, the team, to say, okay, we can embark on the seniors in October. Then we can do maternal health in November. Then we can do this thing in December, you know? Okay. Because we don't want to, especially like December, I would rather us just do something for October and November and just leave December out, because December is everybody's trying to do stuff. People, you know, preparing for the holidays because we have just come out from Thanksgiving and people are trying to get stuff ready for Christmas. So I don't want to put too much pressure on people. So we can just look at doing 2 things for this year and then start planning for every quarter for next year.
Okay.
I just have a question about the scope of this board.
Yes.
From the discussions tonight, it seems like most of what we can do is kind of create events within the community, either through our own funding or through fundraising. Are there other elements of this board? Maybe voting on city policy that affects the health of the community or anything of that nature?
Yeah, would you like to answer that question? Since you are the office and your
it's definitely within the scope of the committee to vote on any relevant policy, issue, or concern, and make a recommendation that it go to the full board for a vote and draft a resolution, whether it be in support of something that would be a change agent for the community. So yes, definitely. Policy matters are welcome to be discussed here, as they are at any committee.
Yeah.
And definite advocacy with our elected officials in terms of policy, because we all know that policy affects and trickles down to the issues that we usually have to address in these forums.
Yeah,
absolutely.
Yes.
All right, thank you.
Yeah, thank you so much for the question. I know Amir is right at the office, and then all the information comes to her, so she'll be able to give you the right answer. Anyone else has any comments, any questions before we go? So Dorian, I appreciate you taking up the helm, and Mr. Michael. Anyone else who have any, as I said, that you will definitely get the invite, and so we will be, the 3 of us will be the administrator for the WhatsApp group. Any information that you have, we know we will be communicating. So as Menacham Am I saying it right? I'm always butchering people's names, so please forgive me.
It's a tricky one.
So,
It's Menachem.
oh, Menachem. Okay, Menachem.
Yeah.
I know whatever I was saying just didn't sound right. Menachem. I apologize. Yeah,
Not at all.
so we will be anything that's happening in the community that you think that that we should as a committee that falls under our umbrella, please don't hesitate to bring it, and then we will discuss it. And when it's discussed based on how the outcome of our discussion on where we say it should go, then I will take it to the executive. It will be discussed further at the executive. And if it merits to be presented to the entire board, that it will be presented to the entire board. What we are looking to do also is other health personnels that you know and you want to invite them to the meeting. If you know someone that you would like to do a presentation, you can invite them. And then since we have those two persons who will be doing the minutes, early enough, we will send out notification to Mia. So then Mia now can put a notification out so the other members of the community will know, okay, we have this presentation coming, and then we can invite other persons and you can invite your friends and other people so that they could come in, because we can, what I usually do, if we have somebody doing a presentation on HIV or diabetes or whatever it may be, we use our platform right now, like the Thursday, we use that time to have the person to come into the presentation. So we will be able to send out notification to the community at large so they could come, and then we can invite. So I'm looking forward to, if anyone have any ties or any of the electives, I would like to invite our council member later on in the year to come on so she could talk to us and let us know what is her vision for the seniors and other things that she may want to do for the seniors, so that we'll know where we are going and how we can work with her, and collaborate with her to bring some more service and stuff to our. Okay. So I think that is it. Any comments, any questions before we say bye?
I have a quick comment, Ms. Fran. I just want to invite everybody to our blood drive at Brookdale on Monday. This is Sickle Cell Awareness Month, and One Brooklyn Health has robust services for persons with sickle cell, but we also try to raise awareness and give education about it as well. Giving blood is significant to that cause. So at Brookdale on Monday, September 11th from 11 to 5, they will be doing a blood drive for whomever would like to donate blood.
And then also Brookdale, they have this diabetes class. I don't remember how they call it, but then some of our board members, they did attend. And then after the few weeks, and just give a little bit more on that, so where persons could register and then can do the class, and they graduate after the few weeks with on diabetes.
Yeah, I think it's the diabetes self-management class. Brookdale has one, Interfaith, as well as Kingsbrook. Kingsbrook's is at Pierre Toussaint Family Health Center. It's the Diabetes Center of Excellence for One Brooklyn Health, and they do recruit persons who want to learn about diabetes self-management. And actually, for Kingsbrook's particular program, they train peer-to-peer, so persons can get certified and go into the community and teach about diabetes awareness. But yes, that class is at Brookdale. I don't know the hours of their class particularly, but if anybody's interested, I can get that information to them.
Okay. Thank you very much. And if no one else have any comments, this would be it. I'm excited with this group. I know we'll do much more work than we've done. And because we have young persons on board, I like when we have young people coming with new ideas, and and the lights are just bright, as I get older. Next month, I'll be celebrating my 60th birthday. So you know what happened. My light is dimming, right? And your lights are shining out now. So, I'm happy that you guys are there, and I'm really looking forward for us working together, putting our heads together, and not just sitting in the box and we just come every month and then we're just sitting here and we are just talking, but we will pull ourselves away from the box and we'll be able to, go out. And sometimes if we like, for Enid, I am was concerned that if we are meeting in person, but we know they're talking about the COVID coming up again, so we don't want to expose persons too much, but persons who are not able. But if we go out somewhere and then it's okay, we're gonna meet out here and we can do an in-person meeting, we can always have our laptop, and the persons who are not able to come, they can still, interact with us, So we are looking to do that and go out there, work the community and see what's happening. We are senior centers, there are shelters. There are different areas. We have shelters for young people, and so we can visit those places. And there's a much more, just let our presence be seen and be felt and be known in the community. We are just not, so we don't just sit behind the four walls of the screen. Okay, so I appreciate it's now 7:44. I appreciate you guys coming in here, meeting you tonight. And as I said, we're looking forward to the WhatsApp group, and we'll be able to exchange our ideas in there. And then we will be discussing a little bit more. I'll be calling a meeting sometime this month. I was supposed to be traveling. I forget to share something. I was looking for it, but I didn't see it. But I just want to share with you guys, especially Enid and well, with everyone, that I was just nominated and been given an award for, let me get it. Okay. All right, so I'm getting an award. It says that we are pleased to inform you that you have been selected to be named to the 2023 Power Woman of Brooklyn.
Wow, congratulations.
Congratulations.
Thank you.
Well deserved, Ms. Fran.
Yeah.
Your light is not
Really,
dim.
that's great. That's for sure.
Yeah, so it will be October. It will be October 5th at La Caribe Country Club. So I'm still feel that I have to pinch myself. So I really couldn't, but I am thrilled. So I'm happy. Yeah, so that is it. I thank you again so much for being here and looking forward to us working together. Barry have not been able to log in, and Deborah, we've not been able to hear from Deborah, but hoping the next time when we meet. So I will be sending, as soon as Dorian send the info, I will plug in my all my information in there. And because when she do it anyway, the telephone numbers and all will be in there, so we'll be able to communicate and call each other as we go. Have a pleasant night, a great night, and a wonderful weekend, everyone. And welcome again to the Health and Social Services Committee.
Thank you.
Thank you. Have a good
Oh,
night.
Deborah. Good. Okay. All right. Good night, everyone.